All right, good afternoon, everyone, and welcome to our live webinar for, let me see, today is Tuesday, June 9th. So let's get started. So these are our walk and talk sessions. I am your host. My name is Rob, and what we're going to be doing today for the next little while is some live exercise that people can do. One question right off the bat, how to use walking poles. We'll address that one towards the end. All right, so I was saying, my name is Rob. I'm one of the cardiac rehab supervisors here, and I'll be leading us through an exercise session today. For those of you that have tuned in before, or if you've been in our program, you'll notice that there's some similar elements through here. We'll do a dynamic warm-up to get started, then a little bit of a cardiovascular warm-up. Do about 15 minutes worth of cardio, and then we'll do a cool down. We'll do a couple of resistance training exercises, some strength training exercises, and then we'll be done. And I will provide a running commentary through the entire session as I try and get things going. There we go. Okay, so just a couple of things to keep in mind, that ideally these exercises are designed for people who have been participating in cardiac rehab. Not that that means if you're not in a cardiac rehab program that you can't participate. By all means, exercise is good for pretty much everybody. But if you're not in a program, just make sure that it's okay for you to exercise. So make sure you get clearance from your doctor. Keep in mind that ideally we should be looking to exercise at least 5 days per week for aerobic training. I do these sessions on Tuesdays and Thursdays, so that's like 1 and 2. So I mean, there's still 3 more sessions to try and get in throughout the week. So please try and do these on your own as well so that you can meet those or get closer to those volume targets of exercise. The video is recorded. If you go to our website, cardiaccollege.ca, they're linked from there. Okay. Likewise, these exercises should be fairly simple and straightforward and not cause you any pain or discomfort. You'll find that your breathing goes up a little bit, your heart rate goes up a little bit. That's to be expected. That's normal. But by no means should you be having any pain or discomfort. If you find you are experiencing any pain or discomfort, please stop the exercises. If the pain or discomfort does not go away, please access emergency medical services as needed. All right, and hopefully you're feeling well. You should be feeling well to do the exercises for today. No symptoms, no chest pain, shortness of breath, dizziness, or anything else like that. Hopefully you've all taken the medications that you're supposed to. And for people living with diabetes, that your blood sugar is at a reasonable level. We know that exercise is a wonderful way to control your blood sugar. It'll help keep it low. You just want to make sure that you don't start low because you could end up going too low. Okay. So let me get the screen sharing out of the way. Stop share. Here we go. And let's get started with our exercise. Right, so the first thing that we want to do before we do our exercise, a good habit to get into, is to make sure that you check your heart rate. So you feel your pulse here at your wrist or up here in your neck, whichever you're most comfortable with. If you can find that thumping, get ready, and I will give you a 10-second pulse check. So ready, set, go. And stop. So hopefully you're getting familiar with what your resting heart rate is normally. And ideally, the number itself doesn't matter too much, just as long as you have something that's consistent and you're feeling well. That is the key. All right, so we're going to start off with our dynamic warm-up just to get the joints and the muscles a little bit ready for the activity that we're going to do. So let's start off doing a little bit of marching on the spot. So we always do 4 dynamic warm-up exercises before we get started. This is our first one, marching, and we should do each one for about 25, 30 seconds or so. Okay, so that's our marching. Next thing we're going to do is we're going to loosen up the big hip joints that we have. So I like working out in my kitchen here at the office. So grab onto something that's good and solid for a little bit of balance. I'm going to use the fridge here, and then we're just going to do some nice gentle swings with our leg. Not forceful, just to kind of wake your joint up and get it moving a little bit. You should be standing up nice and straight and tall. And don't do like me and look to the side. You should be looking straight ahead. I have to look at you guys just so you can hear what I'm saying. Okay, let's switch to the other side. Okay, hips are nice and loose. Next one we're going to do is we're going to do our ankle rotations just to loosen our ankles up. So just lean up against a counter or something nice and solid. And then what we're going to do is nice big circles. See if I can do it here in front of the fridge so it's easier to see. Nice big circles with your toes. And make sure we get both directions. And let's make sure that we get both feet. And we'll get the other direction. Okay, so those are our ankle rotations. And let's just finish off by loosening up our shoulders. Once again, we're not going crazy hard or aggressive, just nice and slow and controlled and deliberate motions is what we look to do. And make sure you get both directions. Okay, so that's our dynamic warm-up. As we talked about last week was a little bit about the hot weather and the need to hydrate, so it's a good idea to have some water on hand. Especially if, like me, you're doing a lot of talking. All right, so let's get into our cardio warm-up. Remember, for our cardiovascular warm-up, you just want to do about 4 or 5 minutes of whatever activity you're about to do at a slightly slower pace. Lets those wonderful coronary arteries start to dilate and get bigger, and that brings a big supply of oxygen-rich blood to the heart muscle. That's important for everybody, in particular cardiac patients, very important as well. Also lets the body take some of the blood away from the gut and redirect it to the working muscles. So it's going to go away from my belly right now, and some more of that oxygen-rich blood is going to go to my legs. We like oxygen-rich blood. The more of it you can get, the more activity you can do. So warm-up is very important. I saw real quick there was a question about, can I show people how to use poles, pole walking properly? Leave that one with me and I'll see what I can do. I know a lot of the physiology behind using the poles, but I've never actually taught somebody how to do pole walking per se. So I'm going to have to see if I can figure out how to do that. I know there's a lot of good video resources online for how to use pole walking properly. I'll see what I can do for whoever it was that was asking about pole walking. Our focus today, because I think everybody knows I like to teach. So while we're doing our cardio, I'm going to be talking about the valves of the heart. There was a question that came in last week just about heart valves and antibiotics and procedures. So I'm going to spend our cardio today talking about valves. That'll be our plan. And if anybody has any questions, if they have any topics they would like to hear me talk about while we're doing our workouts, at the end of the session, if you don't mind just putting it into the questions or the chat box, my colleague Crystal, who's supporting me today, will make sure that we get all those questions, and I'll do my best to try and answer them for the next session on Thursday. So we'll go for about another minute and a half or so of our warm-up, and then we'll look to pick up the pace a little bit. I have to say this is, I'm glad to be doing this, and hopefully the people at home are happy to tag along. You know, as we're into, I think, almost our 11th week of the physical restrictions with COVID, a lot of our patients are older, with cardiac problems, obviously, spending a lot of time indoors. And one of the common concerns I get from people is, Rob, I live in a small apartment. I don't have access to go exercise outdoors. My local gym is closed. My condo gym is closed. I can't access my equipment. We can do this. I mean, I've been doing this Tuesdays and Thursdays now. We're going into, what is our 4th or 5th session, and just marching on the spot in my kitchen. This gets some cardio. So I'm starting to, you know, for people that are saying, I can't do it, I'm starting to think it's not a physical limitation, it's more psychological limitation, that mentally you can't do it, mentally you don't want to do it. Because, I mean, come on, folks, you don't need an awful lot of space to march in one spot. And this will help with a little bit of fitness gain. Okay, so that's our warm-up. So for those of you at home, if you want to start marching a little bit quicker, just to make the work get a little bit higher, that's fine. You can also start lifting your legs a little bit higher if you'd like to make the work a little bit harder. The other thing you can do is you can start using more muscle. So you can start using your arms. The more muscle you use, the more oxygen-rich blood is needed, the harder your heart has to work. So just keep that in mind, and you should tailor your effort to whatever you're comfortable with at home. And I'm just going to stick with the marching because I'm also talking. I have to talk really loudly too so you guys can hear me way across the room. So I'm just sticking with marching. Okay, question for today. Somebody was asking about the valves of the heart. And I think their specific question was around antibiotics and procedures, dental procedures, surgery, stuff like that. So I'm going to talk about the valves, and then I'll answer the question on antibiotics towards the end. So I've said in earlier episodes that the heart is a muscular pump roughly the size of your fist, and it's only got one job. Every cell in your body needs a constant supply of oxygen-rich blood to function properly and to stay alive. And your heart's one job is to make sure the supply of oxygen-rich blood is maintained 24 hours a day, 7 days a week. It's a pretty simple job, but it's very important, and it's a lot of work. I mean, your heart beats 100,000 times every single day. That's a great deal of work. So helping your heart do all of this work are a couple of different systems within the heart itself. And I know in the past we've talked about the plumbing. Your heart requires oxygen-rich blood, just like every other cell in your body. And your heart gets its oxygen-rich blood from the coronary arteries. So that's the plumbing system that's going to supply your heart. Your heart also has an electrical system. That 100,000 heartbeats a day, every single one of those begins with a little spark of electricity. The spark of electricity starts up in the top right-hand part of your heart, makes its way over and through and around the heart, getting it to contract and move the blood around your body that it needs to do. So it's plumbing. There's an electrical system. The third system is, I guess, kind of the structural system. A lot of people will see your heart is like a house. Your house is plumbing. Your heart's got plumbing. Your house has got an electrical system. Your heart's got an electrical system. Your house has got walls and doors. Your heart has got walls and doors as well, structures of the heart. So our topic for today is valves. Valves in your heart are the same as doors in your house. So the heart is a muscular pump with 4 chambers. The 2 chambers at the top are called the atria, The two chambers in the bottom are called the ventricles. The right side of the heart is called the right, and the left is called the left. So it's very important that the blood flows through the heart in only one direction. You don't want it moving back and forth and all over the place, left to right. That's not efficient. You don't want oxygenated, deoxygenated blood mixing or anything like that. Likewise, you want the blood to flow in one direction, so it is efficient. When your heart's doing 100,000 heartbeats a day, if you have a little bit of inefficiency on top of all of those heartbeats, the amount of work that your heart has to do goes up dramatically. So controlling the direction of the flow of the blood through the heart are these valves. There's four main valves that we have in the heart, right? There's one controlling the flow of blood from the left ventricle out through the aorta. There's one between the left atrium and the left ventricle. There's one between the right atrium and the right ventricle. And then there's also one controlling the flow of blood out of the right ventricle out to your lungs. So four main valves in there. Now, a lot of people, as we get older, stuff starts to wear out. And that doesn't come as a surprise to anybody, right? We all know as we get older, our joints start to wear out a little bit. Hips, maybe the knees, the back a little bit. The electrical system in the heart, it can start to wear out a little bit as you get older as well. And I know our medical director, Dr. O, yesterday did a session on atrial fibrillation and cardiac arrhythmias. Those are all examples of misfirings of the electrical system. And as we get older and stuff starts wearing out, quite commonly we'll have more misfirings of the electrical system. Likewise, the valves in our heart, as we get older, they start to wear out a little bit as well. So for most of us when we're born, the valves in the heart open and close seamlessly and flawlessly. I always say it's like a brand new house. You get a brand new house, those doors are hung in the frames perfectly. They're nice and square. They open and close beautifully. All right? That's how the valves in our heart are supposed to be as well. As a house gets a little bit older, it starts to shift and starts to settle a little bit. And those doors that used to open and close smoothly and so seamlessly, maybe they open and close as well as they should. The door frame shifts a little bit, so maybe it's a little tighter in one corner, a little bit too loose in another. The valves still work, the doors still work, but they're not as good as they used to be. The valves in your heart are exactly the same way. As we get older, those valves don't open and close quite as smoothly as they used to be. We've got a little bit of gap and maybe a little bit of space in some of the leaflets that you have in there. So what? What's the big deal? Well, if the valves in your heart don't open and close as well as they should, they can't control the flow of blood as effectively as they should. And you might start getting a little bit of backflow across the valves. You guys have probably heard these terms before. Regurgitation. So regurgitation is one way that your doctor might describe a valve that's a little bit leaky. When they say a little bit leaky, that means some of the flow of blood goes backwards across the valve, through the valve. It regurgitates, it goes the wrong way. You can hear this sometimes when you hear about, oh, he's got a heart murmur. There are a number of reasons that you can hear a murmur in your heart. One of them is leaky valves, okay? As we get older, these valves become a little bit more leaky. Myself, probably everybody at home, once you start getting a little older, you will start having a little bit of leak in the valve. So what? So what's the big deal? Well, as your valves get a little bit leaky, your heart's not moving out blood through all the different chambers and great vessels as efficiently as it should. It means it has to do a little bit more work. A little bit more work's not a big deal. But some people, their valves, they wear out to a much greater degree than other people. And they don't become a little leaky, they become a lot leaky. And if they're a lot leaky, your heart's got to do a lot more work to move this blood through all the chambers in the heart. So what are the consequences of that? The biggest one is you get short of breath, right? We know that if I start running, I'm doing a lot more work. My heart needs to do a lot more work to supply those running leg muscles with oxygen-rich blood. If I do that long enough, I'm going to get short of breath. Well, if you've got leaky valves, you might find that you get short of breath with only small levels of activity. Walk into the end of the block with leaky valves, you get really short of breath. Trying to climb up a flight of stairs, maybe you have to stop after 2 or 3 steps or halfway. Trying to do structured exercise like this can be really, really challenging. So some people, their valves get a little leaky. Other people, their valves get a lot leaky. Some people, when they're born, their valves are not quite perfect right when they're born. If they're not perfect, they might wear out a little bit quicker, or they might not form well at all. And then you've got a leaky valve from a very, very young age. If it gets to the point where the valve is so leaky that it's really causing problems with your quality of life, we need to try and do something about it. So what can we do if you have a leaky valve? Well, leaky valves are typically fixed with surgery. And the good news is there's a couple of different types of surgeries that you can have right now. So one thing you can do, your surgeon can take a look at the valve and they might say, well, the valve is a little bit damaged, it's a little bit leaky, but generally it's still pretty good. Maybe I can just fix the valve a little bit. So they'll do surgery and maybe they can just kind of shim that the one leaflet part of the door over a little bit so it closes a little bit more tightly, a little bit more snugly. They'll leave pretty much all of your heart intact. They'll just repair and tighten up the valve so it closes a little bit more efficiently. It opens a little bit more efficiently. So you can have a surgical repair of the valve. If the valve is too badly damaged that we can't fix it, then the surgeon might talk to you about replacing it. So when we replace a valve, there's generally 2 different categories of valves that we might look to replace it with. One category is something called a tissue valve, where they take a valve from a pig or a cow, works really, really well, and then they take your old valve out and they'll put a tissue valve in that's working much better, much more effectively. When they do that, the new valve will open and close much more smoothly, more snugly. Your heart doesn't have to do all this extra work. It'll make your breathing an awful lot better. So that's a tissue valve. Or they can replace it with what's called a mechanical valve, a synthetic valve. It's got some metal and plastic in there, they put that in. And then that'll open and close beautifully and it will help your symptoms as well. People will say, well, which is better? Do I go for mechanical valve or do I go for a tissue valve? I'm going to preface this by saying I'm an exercise guy. I'm not a doctor. These discussions should be had with your doctor and or your surgeon. But generally speaking, tissue valves will last maybe 12 to 15 years in and around there. Depends a little bit on your lifestyle and things like that. But 12 to 15 years, a tissue valve will often start to wear out again, and you'll need to replace it. Now, if you're 80 years old with a leaky valve, you might think and put a tissue valve in there. I'm not going to be around in 15 years anyway, so I'm okay if it wears out then. But if you're 50, well, you might be thinking of hoping to be around for another 30 or 40 years. Maybe a mechanical valve might be an option. The cool thing about mechanical valves is they will last much longer than you will. They'll be around for decades and decades of time. Generally speaking, once they're in, they don't need to be replaced again. But when you put the metal and the plastic in there, in the heart, it is hard on the blood cells. And you have to take medications to manage some of the problems that you might have with the blood cells, in particular blood clots. So it's quite common for people with mechanical valves to get put on blood thinners just to prevent blood clots and blood embolisms from forming. You'll be on them for the rest of your life if you have a mechanical valve. And it can be a little bit tricky depending on what type of blood thinner you're on. Coumadin or warfarin is a very common one. need to be a little bit careful with your diets because it'll affect the thickness and thinness of your blood. You'll cut yourself a little bit easier, so if you're shaving and stuff like that, that could be an issue as well. These are discussions obviously best had with your doctor. I'm giving you really, really high guidelines for this at all. Traditionally, when we do a tissue and a mechanical valve, we end up doing open heart surgery. So you do have to have your chest opened up, and then they cut into the heart to get into the valves, which is the inside part of the heart. More and more, though, we're able to replace one, sometimes two valves without opening up the chest. They can go in through a blood vessel in the groin, just like they do with angioplasties and stents, and they can thread a catheter, metal wire, up your aorta, into the heart, make its way to where the valve that they need to replace is, and then they can deploy it without having to open up your chest, called a TAVI procedure. And we're starting to see more and more of these. The docs that do them are getting very skilled at doing this, and we don't have to open up your entire chest, which is a pretty invasive procedure. Okay. All right, so let's get some, going to interrupt my story here. Let's get our 10-second heart rate. So find your pulse at your wrist or your neck. Stop marching and just keep swaying left to right like I'm doing, just to keep the blood flowing. And I'll give you a 10-second pulse count. Ready, and go. And stop. So hopefully, just like you're getting into the habit of checking your resting heart rate, hopefully you're also checking your exercising heart rate, and you should be getting used to what your numbers are. For some people, the number might just go up a couple of beats. For other people, maybe 10. Whatever works for you, as long as it's consistent and you're feeling well, that's what we're looking for. Also, not a bad idea to have some water. Okay, so as we do our cool down just for a couple more minutes here before we do our resistance training. So that's the basics of valves. Now, the question that I had a week ago was, I think someone was saying, Rob, do I need to take antibiotics if I have a valve? And there was another part of it I'm just remembering. Do I have to watch my cholesterol if I have valve surgery? So the cholesterol one is easy. We know that if you've got elevated cholesterol, it's associated with increasing risks of coronary artery disease. Coronary artery disease is a plumbing problem. The valves are not really part of the plumbing. So if you've got valve problems, generally speaking, you don't have to worry about cholesterol piling up on the valves and causing problems. We know that coronary artery disease is one of the leading causes of death, which means that I don't care if you've got valve problems or no, everybody should be leading a heart healthy diet. But do you need to do it specifically to address valve problems? No, you don't. The second question was surrounding antibiotics. In particular with dental work, tends to be the common place that people ask these questions. We know the mouth can be a very, very dirty place, a lot of germs, bacteria. If you're going to have dental work done, sometimes we get some bleeding in the gums and everything like that. The worry is that you'll get bacteria into the blood. Of course, the blood's going to make its way to your heart. Can you get any of these bacteria sticking to the valves of your hearts? If you've got your own valves healthy with no problems, generally speaking, taking antibiotics before dental procedures, generally speaking, is not something that needs to be done. If you do have valve problems, though, it's worth it to have a discussion with your cardiologist and your dentist or oral surgeon to see if there's a need to take what's called prophylactic antibiotics. And that's just taking maybe one antibiotic pill before your dental surgery, just to make sure that all the bacteria is nice and low. There's no one answer for this. The best thing is to take yourself and have your situation and talk with your doctor and just ask. But I can let you know that is a very good question to ask. Okay, there we go. Long story all about valves. Let's do our 2 resistance training exercises for today. We're going to start off with legs. As I said, huge fan of doing legs, always important. So let's do our step lunges. For our lunges, what we're looking to do is holding on to something for balance. I'm going to use my fridge here. And then what we're looking to do is step 1 foot out in front of you. And then all I'm going to do is I'm going to lower my back knee towards the ground, making sure that my front knee kind of stays above my toes. I don't want it going way out to the side or way forward. That's not a stable position for your knee, and you can cause a little bit of problems. So we'll do 10 repetitions with one leg. Standing up nice and straight and tall, and looking forward. And if people are looking at me thinking, oh, this is hard to do, it's a hard exercise. If it is, don't go down as far. If you're struggling, I've lost count. Let's see, that's 7, 8, 9, and 10. Let's do the other side. And I'm going to hold on to the fridge just so you can see a slightly different position. One leg out in front, and then once again, 10 repetitions. 2, 6, 7, 8, 9, and 10. All right, so the next exercise we're going to do is it's called a semi-upright row. You guys remember last week I stole my colleague Nicole's shopping bag. She took it back. So I had to bring my own gym bag, which I use when I come here to work. So I'm just going to take some magazines, put them in my bag. Hope you guys can't see that. I put them in the bag, and this is what I'm going to use for my resistance. So for semi-upright row, you're going to grab a chair, because I'm going to brace my hand on the chair. I'm going to have my feet fairly wide apart, one hand on the chair, hanging my bag down like this, and now I'm just going to bring it up to my armpit. 2, 3, 4, 5, making sure to breathe. 7, 8, 9, 10. And we'll do the other side now. I'm just changing my position so you guys can see me a little bit better. All right, this works the big muscles in the back. 1, 2, 4, 6, making sure to breathe. 8, 9, 10. So there are 10 semi-upright rows. I won't lie, I like the idea of bringing a bag for resistance training. So if you guys tune in with me on Thursday, find a bag to bring with you. Books, water bottles, soup cans, something to put in. That's what we're going to be using for our resistance going forward. Okay, we'll finish off with our stretches. So stretch the back of our arms, heart in front, and then pull it across your body. Making sure to breathe comfortably. Holding the stretch for about 15 to 20 seconds. Okay, and then let's do the other arm out front, across our body. You can do it with your arm straight, or you can bend your arm if you'd like as well. Bending it gives it a little bit more of a stretch, which you should be feeling through the back of your arm. Okay, we're going to stretch our chest next. So for this one, place your fingers behind you, or if you can't reach your fingers, just get as close as you can. Pull your shoulders back, chin up, looking forward. Remembering to breathe comfortably. Okay, and then we'll stretch our calves. A runner stretch, we like to say. Both feet flat on the ground, pointing straight ahead. Remembering to breathe comfortably. And then we'll switch legs. You feel the pull in the calf of the farthest back leg. This one. Okay, and then we'll just finish off with our hamstring stretch. So sitting down in a chair. Kind of wiggling your bum to the edge. One leg is going to be straight. And then just reaching forward towards your foot. Feeling a pull through the back of your hamstring, the back of the straight leg. Make sure to breathe comfortably. We'll switch to the other leg. All right, we can shake that off a little bit. Whew. That was a long workout, folks. 137. My apologies, that went longer than I had anticipated. So let me just see real quick. 3 questions. Is there any difference between marching on hard surfaces and soft carpet? Not really. I would encourage you, if you're doing any kind of exercise, to make sure that you are wearing appropriate footwear. So I wouldn't be looking to do these workouts in bare feet. I would make sure that you wear running shoes. They provide the best support, so for sure. And then whether or not you're doing it on a hard or tiled floor or on carpeting, whatever works best for you is fine. There's no real mechanical difference that's significant. And then there was another question about how long stents last. That seems like the only question that we had, so I'm going to answer that question on Thursday. So Thursday we'll talk about stents. So you have to come back, whoever asked me that question. Let me see, one more question. Thank you, Rob. You are very welcome. And how do I know how much weight I should use for the rows? Well, for any of the resistance training exercises, especially if you're new to that particular exercise, the technique, start with something that doesn't feel too hard. You want to make sure it's a manageable weight so that you don't learn any bad habits or techniques or anything like that. But if you go to our website and you do a search for the Rpe scale, it stands for Rating of Perceived Exertion. When you're lifting weights, the Rpe should be from about 11 to a 15. So 15 is, it should feel fairly hard. 10 repetitions, when you're done, you should be going, you know, I'm glad I'm done. The upright rows use some of the biggest muscles in the body. So here on site, when people do resistance training, it's not unusual for people to have the heaviest weights they use be the ones for that exercise. Hard for me to say, if you know you're 35 years old, big strapping guy at home, you might be doing 45, 50 pounds. If you're a little bit older and more frail, 80, 85 years of age, you might find that 5 pounds or even 7 pounds might work for you as well. Okay, so I'm going to share my screen, just a couple of other slides, and then I'm going to sign off for today. Bear with me as I try and make my tech here work. Crystal at home is so proud of me because I'm actually getting better at this. Oh, sure enough, I put my foot in it. Oh, there we go. Oop. Okay, so there we go. So for tomorrow, Fatim, wonderful Fatim. Fatim is lovely. She is one of our 2 dietitians, and she's going to be talking about food labels. Now, this is a session that's very, very popular. It's been given many, many, many hundreds of times here in the program. So that's going to be our session for tomorrow. This is a session that Fatim gave not too long ago. So this is going to be a recorded version. So if you're not able to see it tomorrow at 1 o'clock, it is on our website, cardiaccollege.ca. Okay, folks, that's going to be it for me today. Believe it or not, I'm double booked. I'm actually in another meeting, so I'm going to go run to that one right now. If anybody has any questions, I am going to leave the computer on for a little bit. Please type your questions in, and I'll do my best to answer them in the next couple of sessions. All right? Hopefully this was your first or maybe second session for the week. Remember, we should be looking to try and get 5 exercise sessions in a week. Folks, try and get out there tomorrow and do one more, and I'll see you all on Thursday. Thanks, folks.